Hi, my name is Adam Weinstock, and I'm one of the office managers at Dr. Benjamin Bieber's Cross Bay PMR. Today I'm going to talk about what to do if you don't want knee surgery. Now, I don't know what type of knee injury that you have. It could be an ACL tear, an MCL tear, an LCL tear, it could be even arthritis. But if you have a knee injury and you've either been waiting for months and months for it to heal and it's still something is not right, or you're thinking about surgery and you don't want surgery because it's a very invasive procedure, and also there are some interesting research studies out there that even say that a lot of knee surgeries don't actually fully improve the knee damage, and people just end up with long-term symptoms and complications. So if you're one of those people that don't want surgery, then this is for you as well. So you might have heard about either platelet-rich plasma therapy or stem cell therapy. And these are basically the two options that people are choosing from to repair severe knee damage, which not only are doctors now recommending surgery for, but in the past years, these are the type of injuries that a surgeon would say, get surgery, you need surgery. But these injuries can now be treated non-surgically with stem cell therapy and platelet-rich plasma therapy. And this is what Dr. Bieber does. He applies stem cells and he applies platelet-rich plasma to the knee using ultrasound guidance. So it's an imaging system where he sees exactly where he needs to place the stem cells and the platelet-rich plasma in the knee to get the maximum benefit. So this treatment is great, and I'll explain a little bit about how it works. Firstly, when you come in for a consultation with Dr. Bieber, he's going to give you a full knee examination, and he's going to recommend which treatment is going to be best for you. There's adult fat stem cells, which is stem cells taken from fat tissue. There's bone marrow stem cells taken from a patient's bone marrow, and there's platelet-rich plasma, which is PRP composed out of the blood of the patient. And all three are natural because they're coming from the patient's own body, which is very beneficial and very safe. And Dr. Bieber is going to decide, do you need one of those things, do you need two, or do you need a combination of all three to get the maximum benefit? So, stem cells, either fat tissue or bone marrow, once the stem cells are derived and taken from the patient, they're immediately reapplied, re-injected into the knee. And once the stem cells are in the knee, they're signaled by the brain to physically transform into the type of tissue the body needs to heal itself. This is the job of stem cells. Stem cells are everywhere in a person's body. When an area of the body is damaged, muscle damage, even just through normal daily wear and tear, stem cells are neutral cells that transform into the healthy cell tissue. So once applied to the knee, the stem cells transform into healthy tissue, repair and replace damaged tissue, and allow a significant acceleration of the healing process to occur, such that the injury, the damaged tendon, the damaged muscles, the damaged ligaments, the damaged cartilage, can heal on their own. Some patients fully heal, and then you probably will just need some physical therapy afterwards to continue the benefits and to continue getting mobility from the knee. And when this occurs, your knee continues to heal, this is when you say, okay, I'm getting much better, I don't need surgery. Surgery soon, for many different types of orthopedic injuries, is going to become a thing of the past, with all these new non-surgical medicines. And also the lack of success that knee surgery sometimes comes to, and the long-term painful process that a person has to undergo because of surgery. So that's stem cells. Is a really simple injection technique that repairs damaged tissue and tendon. It's very fascinating how the body works. Then you have platelet-rich plasma, and this is the second thing. And professional athletes are choosing between stem cell therapy and platelet-rich plasma therapy when they get injured. And there's many cases where a professional athlete could have ended their season, but were saved due to this treatment. And there are also situations where, you know, like in national football, where a top player wouldn't have been able to play for the Super Bowl. I'm talking about Hines Ward, but he got I think it was a platelet-rich plasma. I'm not sure. It could have been a stem cell, but either one of those, and he was able to play in the Super Bowl and get MVP because it fixed his injury very, very, very quickly. So platelet-rich plasma is PRP. It comes from the patient's own blood. So Dr. Bieber draws blood from the patient, creates PRP using a centrifuge system. This PRP has over 30 growth factors. It is applied directly to the knee using ultrasound guidance, this imaging system that allows Dr. Bieber to see exactly where the PRP needs to go. And then the platelet-rich plasma is also very great at repairing and replacing tissue damage, as well as repairing blood vessel damage. And this is very important because by repairing blood vessel damage, you get a new blood flow to that area to provide the area with minerals and nutrients that can help the area to continue to heal. So that's why it's PRP is very beneficial. So basically, if you have a knee injury or if you have arthritis of the knee, you want to look at platelet-rich plasma or stem cell therapy first before you consider surgery, because there's really no downfall from doing this treatment. It's completely safe, and it's very, very effective. Many of Dr. Bieber's patients are getting much better from even bone-on-bone arthritis and full tears of the ACL, the MCL, and LCL. They are getting better. So if you have a partial tear, this will definitely work for you. A full tear, Dr. Bieber will have to look at your case and see if this treatment is viable. So the first step to seeing Dr. Bieber is to schedule a consultation with him. So give us a call at our phone number during office hours, which I'll provide in the link below, and schedule your consultation with Dr. Bieber. So we look very much forward to helping you recover from this knee injury. We know you're in pain. We know you're probably, scared about what your future is and trying to avoid surgery, and it's really a hindrance. And in modern medicine, with stem cells, with platelet-rich plasma, it is possible to heal non-surgically from these types of injuries that were once considered where only surgery would work, and not even work that well in many cases. So we look forward to hearing from you. Give us a call to schedule a consultation, and have a great rest of your day or night or whenever you're watching this. Take care.